Okay, so I'm Jenna and that's Hailee, and we are doing our discussion video over person-centered care. So the question of the day that we have is, what is person-centered care and why should clinicians make an effort to adopt it? So we think that person-centered care, it is putting the patients first and doing what is best for them and what will give them the best outcome. And we think that everyone should do this because it's what's doing best for the patient. And then what would be an alternative to person-centered care and what would that look like? So we thought of a care plan, which is what the nurses make at the hospital. We thought this would be a good alternative because this is customized to the patient for their needs at the hospital. And that's really important for the patients there, that they all have the care that they need, especially for them.
Right. And with a care plan, that when the nurse forms it, they have to ask patients all these different types of questions. And they're really involved in what the patient wants and how are they going to form this care plan to specifically make it theirs and theirs alone.
Yeah. And with the care plan, the patients, the doctors, and nurses, everyone needs to be on like the same page for this. That way, like the patient gets what they want and like no one messes that up for the patient. So everyone needs to communicate on this to make sure the patient gets everything that they need there. Okay, so what is person-centered care? So person-centered care, from the article, it is a way of thinking and doing things that sees the people using health and social services as equal partners in planning, developing, and monitoring care to make sure it meets their needs. So this means putting the people first and their families at the center of the decisions and seeing them as the experts and working alongside them to make the best outcome for that patient. And then with person-centered care, there's not specifically like one definition that works for everyone. Everyone has their own care plan that works for them. So everyone needs something a little bit different.
Right. And, person-centered care really focuses on how everybody fits in to making this patient as comfortable and as possible. So, you take the patient, their ideas, what they want in their care, and then you take families' considerations into their care. And then you also work with, all the other staff that's around you for this patient so that your patient is the one that gets that sole care that they really want.
Yeah. And then we both have a few experiences with person-centered care. I work at the hospital I'm a CNA, and I feel more closer to the patients than the nurses do almost, because they go in there for rounds in the morning and then they just go in there for meds and that's about it when they go in there because they're so busy. But I'm in there multiple times a day and they're asking me for this and that, and I'm doing everything in my power to like get them what they need and what's comfortable for them. And I'm communicating that with their nurse also so that they know what their patient needs.
Right. And I worked as a CNA in assisted living, and it was the exact same thing. My nurses we would bring the patients down to see the nurse. The nurse will give them the medication, and that was pretty much it. The CNAs really took care of how the patient was feeling, what they could do to make it better, and especially the family needs, because families are really involved in assisted living. And we put all that together, and we would bring it to the nurses and be like, hey, this is what they want. How are we able to formulate this so that the patient is as comfortable as possible?
Right. Okay, so why is person-centered care important? So we have quite a few bullet points on this, but I believe that this is very important because this helps people get the care that they need and what they want. Like, this is improving their quality at the hospital and their stay, and it's making them happier, and it's going to make them more comfortable in the end, and it's just going to benefit everyone if this person is happy.
Right. And, what's another cool thing about person-centered care is it allows the patient to really take into consideration of their health and how are they able to make these decisions maybe at home, like monitoring their blood pressure or exercising, so that they don't have to come to the hospital for all these medical issues. What can they do at home to treat themselves before they come to the hospital? And patient-centered care, when they're at the hospital and we're doing all this, it gives those patients that opportunity to really learn about it.
Yeah. So we also have some aspects of person-centered care. So for aspects, it's pretty much just like considering those patients, like their preferences and like what they need. Like if they want this instead of this for dinner, like you try and make that happen because you know they'll be more comfortable and they'll benefit from it. They'll actually eat their dinner instead of not eating their dinner.
Right. And one of the real points is emotional support, and, patient-centered care really focuses on that. And how are the patients feeling? What can we do as staff, as involving their family? How are we able to support them emotionally when they're going through this tough time, or whatever the reason they may be at the hospital? How are we able to really incorporate them and the people that are around them to making them feel safe?
Right. It just, even the big things or little things, any of them will make a big difference for this person. So for this entire PowerPoint, we just used the article that was in our homework discussion. And we both believe strongly that person-centered care is something that should be valued more, and it's very important to us. And the patient's needs should come first in the hospital, and everyone should really consider their feelings and their emotions and everything while they're at the hospital. 6 minutes and 18 seconds.
Nice. I think that went really well.
Yeah. Perfect.
Are
Okay.
you still recording?
No, I stopped it.
Okay.
I don't know, maybe.